First trimester scanning in pregnancy. Let us discuss all about it. When would be the first scan done? Why is it done? What can you see in your first scan? Hi, this is Dr. Abinaya Vijayakumar. I am a doctor and a post-pregnancy coach. For those of you watching me for the first time, I take post-pregnancy classes to pregnant women where I teach them how to stay happy and confident throughout their pregnancy and to connect with the child in the womb using simplified gut sanskar techniques. To know more about the course, message me on Instagram or reach out through email. I'll provide the links in the description. Also, I'll provide the link towards the course. If you're really interested to learn more about gut sanskar and to connect with your child, do join the course today and let us meet inside the community. With no further delay, let's get this video started. So when is the first trimester scan done? The first scan is usually done around 6 to 8 weeks of pregnancy, ideally around 6 weeks. Why is this done? For two things. One, confirmation of pregnancy to make sure that that is the reason behind missing of periods and not any other pathological condition. Number two, to check for fetal heartbeat, which is nothing but the baby's heartbeat. So ideally when the period misses, we have to take a urine pregnancy test after 5 to 6 weeks such that we see a strong positive double line on the pregnancy card test. Once we confirm the pregnancy using card test, we can go for ultrasound scan, or if you're sure about your pregnancy without doing the UPT, you can directly go for a scan if it is 5 or 6 plus weeks such that you can see a gestational sac in the scan. So what type of scan would be done when you go for the first ultrasound? Usually both trans-abdominal, that is through the abdomen. Second is trans-vaginal, which is through the vaginal orifice. The scans would be done just because the fetus is too small and sometimes it could be missed on trans-abdominal scan. So how should you prepare yourself for a trans-abdominal and trans-vaginal scan? So if you are around 5 to 6 weeks of pregnancy, you are going for a scan. First, they would be doing a trans-abdominal scan where they would ask you to come in a full bladder, which means you need to drink as much as water as possible and you should have the urge to pass urine immediately. That would be the ideal scenario for the trans-abdominal scan. Why so? Because when you drink lots of water, the bladder gets distended and moves up such that we can visualize the uterus very easily. Otherwise, the bladder will usually be in front of the uterus and the baby is very small by 5 or 6 weeks, such that the sac cannot be seen properly if the bladder is obstructing the view. So once the trans-abdominal scan is done, the doctor would advise you to pass urine and come back for a trans-vaginal scan. So here again the scan probe will be inserted through vagina to see for the gestational sac heartbeat if it is around 6 plus weeks. Just to make sure that the pregnancy is not missed and the findings are accurate, trans-vaginal scan would be needed if the pregnancy is around 5 to 6 weeks of gestation. But as pregnancy advances like 12 weeks, 20 weeks, there is no need for a trans-vaginal scan and only the trans-abdominal scan will be more than enough to check for the growth and development of the baby inside. Many of the mothers, especially in rural places, do this mistake of doing the first scan after 12 weeks, that is after 3 completed months, which is very late for the first scan. Sometimes if it is ectopic pregnancy and if it is not diagnosed at an earlier stage, this could lead to rupture of ectopic pregnancy, which is a life-threatening condition for the mother itself. So please make sure that you do your first scan around 6 weeks of pregnancy. If by the first scan the gestational sac is seen, fetal pole is seen, but there is no heartbeat, do not get frightened. Do repeat the scan after 2 weeks to check for the fetal heartbeat. Most of the time the fetal heartbeat would appear. Sometimes it would be earlier to check for a fetal heartbeat in the first scan itself. So do not get stressed out and repeat the scan as per your gynec advice. I hope you found this video useful. Do like, comment and subscribe to my channel and press on that notification bell icon so that you don't miss out on any new videos in my channel. Until I meet you in the next video, stay happy, stay mommified.